Welcome back to Primetime News, and a special welcome to those of you watching online at onespotmedia.com. There are now 252 confirmed COVID-19 cases in Jamaica. The figure rose today following 19 new cases, which was announced by the health minister a short while ago. Now, TVJ's Andrea Chisholm was listening and now joins us live. Andrea, what's the latest?
Well, Herman, we must tell our viewers that this press conference is going on as we speak. But in the early part of the press conference, the health minister, as you indicated, told us that there were 252 confirmed cases of COVID-19. And he gave us the breakdown of the 19 additional cases that Jamaica has recorded in the past 24 hours.
9 of these which we just received, we will provide additional information on in terms of male-female split. But 10 we received earlier today. Of that 10, 2 are males and 8 are females, with ages ranging from 20 years to 50 years. 7 are associated with the workplace cluster. 2 cases are contacts of confirmed cases, and 1 case, this is of the 10, is under investigation. There are now 131 confirmed COVID-19 cases related to that particular workplace cluster. Their ages range from 18 to 52 years, including 104 females and 27 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew.
And we know that the workplace cluster that has been in the news for the past couple of weeks is that of the Alorica call center in Portmore, St. Catherine. Now, other additional information regarding the case classification: 34 cases have been imported, 53 are contacts of a confirmed case, 8 local transmission, and 148 under investigation. Other important info: the health minister also pointed out that 814 persons are now in home quarantine in St. Catherine. 28 persons have recovered so far and 6 persons have died. Now, tracing will continue for over 1,400 persons who are contacts of a confirmed case. Now to the situation at the Ministry of Health. The minister indicated today that so far 7 staff members of the health ministry have tested positive for COVID-19.
This clearly is concerning to us at the Ministry of Health and Wellness, but in a sense it is expected because of the higher level of risk that public health workers have to face in being on the front line and carrying this fight to overcome this public health threat. In other words, if you look at every country in the world faced with major public health threats, it is the people on the front line, the public health officers, the doctors, the nurses, the contact tracers, the community public health staff. They are the ones who have to interact with persons who are vulnerable, who are affected, and even with the precautions that we insist on them taking, and even when they take the precautions, there's always a margin of error. There's always the possibility, putting on the garb, taking it off, disposing of it, talking to someone who they may not have been aware was affected.
Now, to help minimize the spread, the health minister indicated that they have begun to sanitize key areas at the health ministry, and the staff as well as their family members are receiving counseling. He also indicated at the press conference that is still in progress that 100 additional samples have been collected from Ministry of Health personnel. So, Herman, we expect in the days ahead that we will hear the outcome of the 100 samples that are gone for testing.
Okay, thank you very much, Andrea Chisholm. Janella?